It's about 8:30 in the morning and I'm just on my way into the hospital, so let's go. Hi, my name is Suzy. I'm one of the nurses in Cath labs at Harefield Hospital. I've been working here for just over 4 years. I started off on the acute coronary care unit and I've been in Cath labs for about 3 years now. The first thing that we do once we've got changed is head to the nurse's office and find out where we've been allocated for the day, and then we head to the lab. I first fell in love with cardiology in my second year as a nursing student, where I spent 12 weeks going around in different areas and loved how technology and people and a fast-paced environment all came together. It's certainly fast-paced here at Harefield Hospital. We accept cardiac arrests as well as heart attack patients, and we do a lot of angiograms and angioplasties, which is where we look at the arteries that supply the heart muscle, and then if there are any narrowings or blockages, we then open them up with balloons and stents. So this is where we bring patients in. They wait here while they're going into the lab, and we do checks including their name, medications, any background information that we need to know. They then go into the lab and we bring them into our recovery area. There's space for 3 patients, and they might come here for an hour or so if they've had a general anaesthetic before they go back up to the ward, or if they haven't had a general anaesthetic it might just be half an hour or so. They can then go back to the ward, have a cup of tea, something to eat, and then get discharged within a few hours. At Harefield we have one of the shortest door-to balloon times of about 20 minutes, which means that from the time that the patient arrives at the front door of the hospital to opening up the artery that's blocked, we do all of that within 20 minutes, which means a lot of running around, and it's very fast-paced, but that's what we love here. Now we've been pre-alerted by an ambulance to say that they've got a patient that's having a heart attack that needs to come into the hospital. So I've got this trolley ready so that as soon as they arrive we can get cracking. So what we do is when they arrive we get them onto the table, we inject local anaesthetic into their wrist, and then we use this tube which sits just here, and then through that we pass wires similar to this one, up the wrist, up the arm, around the shoulder and into the arteries that supply the heart muscle that are just outside of the heart. And then we attach this to contrast dye, and through these tubes we then inject here through a tube that's going into your body and round to outside the heart, and that's how we inject the dye into the arteries. We also do procedures like pacemakers. We can put valves into the heart, as well as looking at the irregular heart rhythms inside the heart. We've got about 100 members of staff here, and that includes nurses as well as doctors, radiographers and cardiac physiologists. So now I'm going to show you Cath Lab 5. This is where our new lifeline lab is going to be built. You can see we've got our patient table, monitoring screens, our echo machine, as well as where we do the x-rays from, and our ventilator. I'm going to show you around here where we keep our stock. As you can see, there's not much space and we don't have very many cupboards. One of the good things about our new lifeline lab is that we'll have much better space. It will be better designed, which includes not having the LED screens at the back there where we can't hear very well, and it will mean we'll have better radiation. So that means our x-rays will be more modern, which means the doctors will be able to see what they're doing better, as well as using less radiation, which is more safe for both patients and staff. And now I'm going to show you Cath Lab 7. So this is one of our more modern labs, which means that we can work more efficiently. We've got the ventilator machine in the background there, which allows us to do our general anaesthetics, as well as x-rays and monitoring screens. So these allow us to see what we're doing better because they're just more modern equipment. And we've got microphones and speakers built into the lab so that wherever we are, we can hear what's going on. That allows us to work more safely and again, more efficiently. This is hopefully what our new lifeline lab is going to look a lot more like. It's going to make working here much better.